Final question is, since I do work at the hospital, my second dose was January 7th. My arm hurt. And it happens, and it hurt for a couple of days, but I've had no other side effects. Can you talk briefly about people who are concerned about side effects, what the incidence of them are, things like that, just to address the people who may be concerned about participating in this, in the immunizations because of stories they've heard?
Yeah, and I think it's really important for us to, distinguish. There are very, few true reactions to it, and they typically are early on with an allergic reaction, and that can be dealt with and has been very effectively. So as far as the side effects go, though, one of the things that you have to remember is that you're presenting your immune system with a photocopy of the enemy. And so they have to begin. I always think of our immune system as our generals in the Army, and they're coming together. They're going to share that information. Again, I'm knocking things off the dais. I'm so sorry. They're going to share that information throughout the other cell lines in the immunologic response with the other reactions that need to be made. And they have to get a little fired up because they have to share that information. And so they actually meet in your lymph nodes to, begin to interact and talk. That's the war room. So you might get a little bit of, swollen glands. You might get a little bit of a low-grade fever. You might feel kind of achy. You're going to need to drink some fluid, maybe take some Tylenol to tell them to chill just a little bit. And you might feel like sleeping. So particularly with the second dose, we say, plan on maybe having a lower key day and use some Tylenol, lots of fluids, and rest. But that can be a really good response. I mean, not everybody's immune system is quite so verbose in the way they let you know that they're mounting the response they're supposed to, but that's natural. And we would expect to see some of that. And some people get a little bit more achy than others, but there are those who don't really have a response either.
So it's a sacrifice to do the most loving thing you can do.
Yeah, actually, it is a sacrifice doing the most loving thing you can do, but it's just part of the process. This is part of how your body is going to respond and be ready to fight the infection. And if you don't give them the photocopy and they're not prepared to stand in that gap and say, you shall not pass when they see the virus, then you will definitely know that you got the virus. And I think if you speak to anyone who's, had a more severe response to the virus, the vaccine and giving your immune system a heads up is definitely worth it.
Not only for you, but for the family. And
absolutely, for our whole community.
Thank you.
Certainly.